Okay, so we're going to talk about hormones. So we have angiotensin again, antidiuretic hormone, aldosterone, atrial natriuretic peptide, and we're actually not going to talk about parathyroid hormone, so we're not going to worry about that. All right, so here's renin angiotensin again, and this is the picture from the book. So here we start, the stimulus is either sympathetic nervous system turning on or low blood pressure. Okay, so the receptor in the control center are actually in the kidney. Okay, so they're in the kidney, and we've been saying kidneys, okay. So the juxtaglomerular apparatus in the kidney is what detects the low blood pressure, and the juxtaglomerular apparatus is what releases the renin. Okay, now, angiotensinogen is the inactive hormone. It comes from the liver, okay, and it's hanging out in your blood. It's released into your blood. Okay, so renin is going to come in, and it's going to activate angiotensinogen, and it's going to make it angiotensin 1. Okay, now remember, any protein with the O-gen at the end is inactive, so that's what we have to turn on. We have to modify it somehow. Okay, so renin's what activates it. So we get angiotensin 1. Angiotensin 1 is not totally active yet. It's like a halfway point. Okay, then angiotensin 1 is activated by ACE, which comes from the lungs. Okay, so ACE comes from the lungs. It turns into angiotensin 2, which is our active hormone. Now here's the effects, the effectors, what all can happen, what angiotensin 2 can make happen. So we're getting bigger picture. Okay, so it can cause vasoconstriction, okay, so which will increase blood pressure. It's going to decrease GFR. Okay, so that's going to decrease your urine output. Okay, which will increase blood volume, increase blood pressure. Okay, it stimulates the hypothalamus, so you drink. It causes the release of antidiuretic hormone. It also is going to cause the release of aldosterone, which we're going to talk about here in a minute. Okay, now, antidiuretic hormone. So I want you to think, okay, diuretic. What's a diuretic do? Makes you pee. Caffeine's a diuretic. Okay, makes you have to go to the bathroom. Okay, so antidiuretic hormone is going to do the opposite of that. Okay, so the stimulus is either angiotensin 2, low blood volume, or increased blood osmolarity. So the concentration of the blood is too high. Okay, the receptor and the control center are the hypothalamus. Okay, the hypothalamus is going to talk to the posterior pituitary, and it's going to tell it to release antidiuretic hormone. Okay, so remember, there's only a couple hormones that come from the posterior pituitary. ADH is one of them. Okay, so ADH is the active hormone. Okay, so makes you thirsty. Okay, so if you drink, that's going to increase your blood volume. That's going to increase your blood pressure. It's going to increase water reabsorption. Okay, so what it's going to do is it's actually going to insert water pores, okay, so that we hold on to water. Okay, so it's going to increase water reabsorption. Okay, so if we increase water reabsorption, that means that your urine output is going to go down. Okay, and antidiuretic hormone actually is also known as vasopressin. And if you look at that, you can see vasopressin. Vasopressin will cause the blood vessels to constrict, and that'll increase your blood pressure. So all that's going to lead to increase in blood pressure. Here's like a story. My kids have hemophilia, and they have a synthetic vasopressin. It actually causes blood. It's a vasoconstrictor. So if they get really bad blood nosebleeds, they take this synthetic vasopressin. It's called Stymate. They take this synthetic vasopressin. It causes the blood vessels to constrict in their nose, and it stops them from bleeding. Okay, now it has side effects. Okay, so they're only allowed to do 1 squirt of nasal spray a day. And when they're little kids and it's hard to get that nasal spray in their nose, they're like, no, you can only do 1 because it's going to make them thirsty. It's going to increase their water reabsorption, and it'll also decrease their urine production. So they could become anemic or end up with high blood pressure. Okay, so that's just to try to help you remember it. Okay, now aldosterone. Now aldosterone, this is one, my trick to remember it is if you look, it's got sodium in the name, so SOD. So it's the salt retaining hormone. Okay, so you're going to retain sodium with it. Okay, so the stimulus for aldosterone is angiotensin 2, decreased sodium, or increased potassium. Okay, so the receptor and the control center, they're going to be the adrenal cortex. Okay, and you guys know what the adrenal cortex is. Okay, so aldosterone is released. Okay, it's going to bind to the DCT or the collecting duct in the kidneys. And what it'll do is it's going to increase sodium retention. And then if it increases sodium, it's going to increase water retention. Okay, so in the long run, what it'll do is it'll decrease urine output. Okay, and blood plasma will be maintained. Blood potassium will go down. We'll actually get rid of some potassium. So we maintain blood volume and blood pressure. Okay, so there, it doesn't cause like really huge changes in it, but it helps maintain it. Okay, so sodium, aldosterone, salt retaining. Okay, now the last one I have on here is atrial natriuretic peptide. So if you look at this word, okay, natriuretic, what's the chemical signal for sodium, symbol for sodium? Na. Okay, so this one has to do with sodium too. So the stimulus for it is going to be high blood pressure. So the baroreceptors in the atria are going to detect stretch. Okay, so the receptor and the control center is the atria. Okay, so the atria, or the right atria, is where it comes from. Okay, so they release the peptide, which sometimes is called factor. Okay, and the changes that it's going to cause. Okay, this one, it does the opposite of the other 3. Okay, so it's the opposite of the other 3. Okay, so its stimulus is increased blood pressure. Everything else was decreased blood pressure. Okay, so this one's opposite. That's important. Okay, so what it'll do is it'll do vasodilation. Okay, so blood vessels get bigger. It'll increase glomerular filtration rate. Okay, then we're going to increase how much sodium is lost. And that means we're going to increase urine being secreted or lost. Okay, so we'll increase sodium, increase water. Okay, so then that will decrease blood pressure and blood volume. Okay, so you have to go back and think about the kidneys. This is going to work on the DCT and the collecting duct.